motion, first we'll do goniometry. Okay? Goniometry, first of all, the motion is straight up and down, isn't it? This is shoulder flexion. It's in what plane? Sagittal plane, so it must be around a transverse axis, and the axis happens to be at the humeral head. Okay? My movement arm is in line with the humerus. It's in the midline of the humerus. Okay? The stationary arm, you've got a choice, remember. You can make it, go ahead and flex your shoulder. You can make it either perpendicular to the table or floor, as I am now, or you can make it parallel to the trunk. As long as you're consistent, I don't care. Okay. So once he's in this position in full range of motion, I'll line up the humeral head with the axis right here. Movement arm with the middle of the humerus. I choose to do the perpendicular to the table. Go ahead and relax. 160 degrees. Okay? What's normal expected range of motion for this? 170 to 180. Seated, gravity maximized. The first thing I want to do is tell the patient just to lift his arm over his head. And I'm not actually pulling him or pushing him. I'm just literally guiding him with my fingertips. He's doing all the work. So right now, if he does that for me, that right away is a grade 3, right? Because he went through full range of motion against gravity maximized. Line is left side, thumb there, yep, good. Okay, arm like this, okay? And this hand is underneath, not pushing him into flexion, simply holding him so he doesn't have to also hold against abduction, okay? Do I have to bother with trace? I just felt it before. I know I got a trace. So now I just want to know, am I getting a movement? So I can stabilize the shoulder here, okay? And I can say, go ahead out in front of you. And I can check to see how much range of motion he has. And depending upon whether he goes 30, 45, 90, 180, will dictate the grade of manual muscle test. This is a transverse plane motion, right, around a vertical axis. The axis, you have a choice. We said you can go up top, but it's more accurate to go on the bottom. So I'd place stationary and movement arm parallel to the ulna. The axis is at the olecranon process. Okay? He's going to then go out to the side as far as he can. I'm going to take the movement arm and follow it along with the ulna. Go ahead and stop there. Drop this away and read my measurement. My measurement is 94 degrees. If I did it supine, spin around with your head here, please. Okay. And I'll drop down so I don't get in the way of the cameras. It's going to be abducted to here. Okay. There'll be two tables together, so he would slide off and be able to rest his arm on the table. Okay. Now you're here. Okay. Lined up with parallel arms, at the stationary movement arms are parallel. Again, your axis is at the olecranon. So all I've done is take it from here where he was seated and bring the goniometer with me out here. Does that make sense? He goes back as far as he can. This arm stays perpendicular to the floor. This one stays parallel to his ulna. Go ahead and relax. And in this direction, he has 108 degrees of external rotation. And that's normal to have more when you're up in this position. His arm off the side like this. Okay. Go ahead and let it relax. So first, he's straight down like this. Okay. And you're instructing him to leave his arm right here. Go ahead and rotate his fist up toward, you can just put your fingertips here, up toward the ceiling. Okay? If he does this, again, that's more than a trace. That's gravity maximized, that's a 3. Okay? And now, in this position, sitting up nice and tall, he's going to rotate his shoulder, his forearm out to the side like this. Okay? I've already detected if there's a trace contraction, so I don't have to bother. I can just stabilize here. And here's the thing that I want you to be careful of with this one is that patients may want to cheat using their deltoids and supraspinatus. So if you're going to stabilize, I suggest you stabilize right here at the elbow joint. Not hard, but stabilize here and have him bring his elbow out to the side. That way you know it's pure external rotation. And if you get to the point where he can do that and you want to provide resistance, then you would stabilize here at the elbow joint to keep that elbow adducted and then provide resistance here. Come on out all the way. Horizontal abduction. Okay? To measure with the goniometer, we do it seated, right? And we said that the large goniometer is going to be kind of challenging to use. You can use it if you want to, but it's a bit challenging. Okay? And horizontal abduction was up here with the shoulder abducted to 90 degrees. As soon as you take the shoulder and bring it up to here, this is 0 degrees of horizontal abduction. This is neither abducted nor adducted. Okay? We want to go abduction, behind the body. So this is the motion we're measuring right here. Okay? And we had a choice, you said. You can actually put the goniometer here behind the neck, which I told you in lab earlier was a little bit funky. You can do it. I prefer to go here. So the axis, this is a transverse plane motion. The axis is therefore vertical, right through the humeral head. Okay? It's coming straight down. So I'll begin with stationary arm and measurement arm parallel to the humerus in this midline. He's going to go behind his body. This arm stays here. Movement arm follows the humerus. Go ahead and relax. Extension to flexion is, from right here. This is a sagittal plane motion. So it's got to be a what axis? Transverse. It's got to be right here. So the axis of rotation is going to be here at the side. And the two bones we're measuring are the humerus relative to the ulnar radius. Okay? So axis is here. He's going to go ahead and flex his elbow up as high as he can. I'm going to line up the axis at the lateral epicondyle of the humerus. This is going to be in midline of the humerus. This is going to be in line with the radius. And that's my measurement. So in a seated position, the primary mover we said was biceps, right? So biceps, remember where that bicipital groove is, okay, that painful spot in the front? That's where you're going to palpate. So you can start off right here, just having them go ahead and bring your hand up to your shoulder, okay, and let it relax. And you can feel the biceps contracting under your fingertips. If you can do that, you know you've got a trace. If he didn't move, then you would say, go ahead and do it again, and you'd feel for the trace contraction. Then bring him to gravity minimize. What's gravity minimize for elbow flexion? That's supine. So lay on your back, please. Okay. Exactly. And you position him just like this so that he's got the table over here to slide on. So his arm should be pretty close to 90 degrees of abduction. Some of your patients might not be able to do this, of course. Pretty close to 90 degrees of humeral abduction. And then he's going to supinate his wrist and just slide his forearm, his thumb, along the table in elbow flexion. That's gravity minimized. Wrist extension, the best way to measure goniometry, wrist extension is going to be on the ulnar border. Okay? So resting with his hand on the ulnar border on the table. Okay? The axis of rotation is going to be the carpals. Okay? So it's basically over that anatomical snuff box that you have. If you were to pull your thumb back into full extension, there's a small recess here called the anatomical snuff box. That's where the scaphoid or navicular bone lives. That's a very important site for us as athletic trainers to palpate when somebody falls on their wrist because it's a common fracture site. Okay? So that also is the place where you're going to place the axis of rotation. The stationary arm is going to be in line with the radius. The movement arm is going to be in line with the metacarpal. In this case, the second metacarpal. Okay? So axis, he's going to go back as far as he can. I'm going to bring this parallel with the second metacarpal and then get my measurement. Same thing. Identical, other direction. So you start off with the wrist flat on the table. You bring them slightly into supination, right? By bringing him into slight supination, that makes it so that when he goes into extension and radial deviation, he's basically going straight up. So you're turning the wrist to angle it so that you're going directly against that big black arrow coming from the ceiling we talked about. Okay? If you leave him in full pronation, flat on the table, and you have him go into extension, then there's no radial deviation there. It's by having him do this that you get the combination of extension and radial deviation. So you're going to stabilize here at the distal forearm, okay? And then you're going to put your resistance right, essentially just proximal to this second MCP joint. Okay? So a couple of fingers right here, and then he's going to pull up against me into that radial extension and radial deviation wrist extension. Okay? That's gravity maximized. You just actually turn the hand more so that the vector of force is more in the transverse. Remember, almost always gravity minimized is going to be in that transverse plane. So it's like this now, so that when he comes out into radial extension and radial deviation, he's coming out in this horizontal plane rather than this vertical plane.
So it's like
Wrist ulnar deviation, goniometry only, right? So we're going to pretend he's on a table. If it's goniometry only, it's flat on the table, pinky side, bending, okay, toward the ulna. Okay? This is a transverse plane around a vertical axis. So the axis goes on top of his hand, but it's on the carpal row. He's going to bring his hand as far out. The stationary arm is in line with the midline of the forearm. This, and again, is parallel. That's key. That's critical. Did you get that? So it's base of the third for the axis, and it needs to be lined up with the third, so middle finger, third metacarpal. So when the pen is holding on to the pen like this, okay? You're going to be in front, and remember, you're going to be lined up with, make sure the pen is coming out the top, because you're going to be lined up with, in between the fourth and fifth knuckles, the MCPs. Because the goal is that, and see how he's slightly in some ulnar deviation? Don't allow the patient to do that. They should be in neutral, because that's going to place this axis in line with the ulna, because the radius rotates around the ulna when you supinate and pronate. So in that case, you'd be seated in front of the patient, so I'd be seated around front. I'd place this axis here, in between the fourth and fifth. Again, you can even make a little dot there if you want on the patient. And then we just said it was going to be supination. He's going to rotate this way as far as he can. I probably want him to be off the front edge of the table a little bit, right? Because the table will restrict him otherwise. This stationary arm stays perpendicular to the table. The movement arm moves parallel to the pen. Supination. You had a choice, right? You can actually grab the wrist, or you can shake hands and restrict them going into supination. So you can shake hands, palpate, have him go ahead and pull his wrist out to the outside, move palm up, you can tell the patient, whatever the case is, okay? If they can do that against some light resistance, you don't have to bother with the trace. Queen wave is supination, pronation, minimized. So you'd have to stand up above them, grab the hand, grab the wrist like this, or position yourself above them so you can restrict them in this movement. And we said CMC was this, flexion was this. And again, we're measuring the joint between the radius and the first metacarpal. So that's the carpal metacarpal joint we're measuring. So in his case, and once again, this is the one we talked about, so pay attention to this. You got this? You ready? Okay. Remember, if you keep him in neutral, then you've got to do some mathematics. Because if you keep him in neutral, when you put the axis of rotation, this is a transverse motion around a vertical axis. The axis is, again, that scaphoid, the anatomical snuff box. When you put the axis right there, as soon as he begins in neutral, before I even start the movement, I'm already at 19 degrees, okay, between his radius and his first metacarpal. When I have him extend his CMC joint and move this joint, move this arm, the center line parallel with that first metacarpal, I go from 19, now I'm at 44. If you want to avoid the mathematics, then you would put him into a slight degree of ulnar deviation so that it's a straight shot from the radius axis down to the first metacarpal. Then you're starting off at 180 or 0. Then he extends. As he extends out, don't let him ulnar deviate. Exactly. Watch for the cheating of that. Make this parallel. And in this case, he went 20 degrees. If he's resting on the table, which he would be, I'd be palpating the lumbricals, right? So my fingertips would be right in the palm, just below, or just proximal to the MCP joints. Palpating the lumbricals, and then he's going to push directly straight up. And I'm gently squeezing on the dip, and then he's going straight up. This is gravity maximized, and this turns sideways on the ulnar border is gravity minimized, pushing against me this way. Okay?
So you choose one finger at a time, or
you would choose one finger at a time.